that research in this area is relatively new. I see one little a question from the chat. So does it have an effect of the microbiome and or pH? So there are a lot of studies that we'll go through that talk about the vaginal health index as well as the pH. There's one study that looked at microbiome, but it was really, really small. It doesn't seem to make any deleterious effects, but I think that's an area of active research right now. So getting back to kind of the landmark study in 2014 out of Italy. Again, this was one of the first studies. You had 15 women. There were some validated objective questionnaires. So they looked at the FSFI, the SF12, and then the vaginal health index. They did 3 treatments with 3-month follow-up, which is pretty typical for most of these studies. And as you can see, they looked at dyspareunia, vaginal dryness, vaginal burning, vaginal itching, dysuria. All of these were statistically significantly improved from baseline at their 12-week follow-up, and very similar results for the FSFI domain scores. So that was kind of one of the first studies that indicated that there might be some benefit. There, on the United States side, there was a landmark study from Sokol and Karam that came out in 2016. This study looked at 30 women, again, same treatments. They had 3 treatments with 3-month follow-up. Very similar objective validated questionnaires, so FSFI, SF12, Vaginal Health Index, and then they actually looked at VAS scores for assessing the vulvovaginal symptoms. 26 out of 27 women who answered whether or not they were satisfied answered that they were extremely satisfied or satisfied. And then if you look at their VAS scores for symptoms of vulvovaginal atrophy, again, you can see each one, pain, burning, itching, dryness, dyspareunia, and dysuria were improved over baseline. So that's kind of the landmark United States study from 2016. This study was also continued for 1-year outcomes, so the same 30 women. They lost 6 to follow up. After their 3 sessions, they were followed up 1 year later. It's important to note there were no adverse events that were identified. 22 out of 24 who answered the question about satisfaction stated that they were either satisfied or extremely satisfied. And they also looked at some objective measures of whether or not they were able to utilize the same size dilator or larger dilator after their last therapy session, and 95% of those women were still able to achieve that dilator size at the 1-year mark. And a couple more results. Again, they looked at the VAS, which was their primary outcome in their 3-month study. And again, you can see even at 1 year, they're still, statistically significant